there. My name is Becky, and welcome to Bisana Health and Wellness. We are doing some virtual wellness sessions of various topics, and today we will be discussing vitamin D, which is one of my most favorite supplements of all time. I get asked this question a fair amount, like, can't we get enough vitamins from our diet? And I would say not really. In fact, I think it's almost impossible to get all the vitamins we need from our diet alone, unless you have a perfect diet and eat food raised in perfect conditions with perfect soil. And the soil we have now is just not perfect. It's not as nutrient dense as it once was 50 years ago because of pollution, different antibiotics that are used, the use of microwaves, and such. For example, today you have to eat 12 bowls of spinach to be equivalent to one bowl of spinach in the 1930s. So since we don't have perfect diets, we have to supplement. A piece of advice: do some research about vitamin quality. There's a big variation in quality of vitamins, and you don't want to get cheap, ineffective vitamins. So we do sell high quality vitamins in our office. We have researched and vetted some different manufacturers, and we have those available to buy. You can also buy good quality supplements at Vitamin Cottage or Sprouts. Just do your homework. I know Sprouts will often have like a 25% off all their supplements kind of sale, and that's a good time to get in. And here are some websites that you can order supplements from for those supplements that are not available in our office. And these, again, are the ones that we have researched and vetted and feel really comfortable recommending. Okay, vitamin D. Probably my most favorite supplement because I feel like it's the supplement that has the most impact on how people feel. As you can see, vitamin D impacts many cells in your body. It affects your bones, your heart, your brain, your mood, your immune system. So the vitamin D receptor is expressed in almost all cells, and therefore it's a really important component in how cells function. In a recent study I read, there were 13,000 healthy men and women, and it showed that low levels of vitamin D increase the risk of death from all causes by 26%. A European study about breast cancer showed that as vitamin D levels went up, the incidence of breast cancer went down. So this is why it's one of my most favorite supplements, because it can do so much good. I have told patients before that if they only listen to one of my recommendations or agree to take only one vitamin, I pick vitamin D. So vitamin D is known as the sunshine vitamin. It can be made in the skin after exposure to sunlight. Unfortunately, almost half of Americans are vitamin D deficient. And there's some bad effects of vitamin D deficiency, kind of commonly brain fog, fatigue, decreased immune support from your immune system. And the truth is that we really don't get enough vitamin D from the sun, even in Colorado, where we have 300 plus days of sun. Most of us wear sunscreen and try to protect ourselves from the damaging effects of the sun. Therefore, we need to supplement. You can check vitamin D levels in your blood. The normal value is about 30 to 100, but optimal values are 60 to 100. Now, I see a lot of patients coming in with values of 20 to 30. So at a level of 30, you are technically normal, but certainly not optimal. If there's any anxiety or depression present for patients, we like to see the levels more like 80 to 100. So when ordering a vitamin D test, the 25 hydroxy vitamin D is the one to order. Many conventional medicine providers will check vitamin D levels on an annual basis. I feel like it's good to check it at least once a year, or if you've identified a deficiency and started supplementation, you can check a level about 6 to 8 weeks after good supplementation, just to see if you're absorbing well and if the level is going up appropriately. I had a patient of mine who was a physician and friend. Her vitamin D level came back very low at about 17. And I looked at her and I said, I asked her like how she felt mood wise. She got a little emotional and responded she wasn't feeling great. So it was nice to say, hey, listen, your vitamin D level is really low. And I wonder how you would feel if it was more optimal. Vitamin D is actually a prohormone or a precursor to other hormones. The characteristics of vitamin D are similar to hormones, and therefore some people actually refer to vitamin D as a hormone rather than a true vitamin. So there are different formulations of vitamin D. There's vitamin D2 and D3, but when we talk about supplementation, we're talking about vitamin D3, and that is the supplement we generally recommend. Vitamin D is a fat-soluble vitamin versus water-soluble. What that means is it is best absorbed with food. However, it is okay to take vitamin D without food. In fact, I don't take my vitamin D with food because I do a fair amount of intermittent fasting. And so I just take it in the morning on an empty stomach, and it really is well tolerated either way. The recommended dose of vitamin D is 5,000 to 10,000 international units every day. Often when people come in low on their vitamin D level, I'll recommend they take 10,000 international units for 3 months to get the level up, and then back off to 5,000 international units to kind of maintain that level. And honestly, this is something you probably need for the rest of your life. Be careful what you buy in the store because a lot of the vitamin D supplements come in 1,000 and 2,000 unit capsules. I had a patient who said she just purchased a bunch of vitamin D from Costco and it was 1,000 IUs, and she it up, take 10 of them at a time and get the proper vitamin D you need, but that goes pretty fast. You can get vitamin D from the sun, as mentioned previously, but you really have to be naked in the sun for 30 minutes every day to get enough vitamin D to keep your levels up in that optimal range. So that sure seems like a lot of naked. So some people will ask, isn't there vitamin D in my multivitamin? There is, but it's not enough. I think the average multivitamin has maybe 4,000 or 400 international units of vitamin D. A glass of milk has 100 international units. Remember, we need more like 5,000 to 10,000 daily to keep those levels up in that optimal range. As far as food sources, salmon seems to be the best as far as a food source for vitamin D, but most foods just don't have enough vitamin D. Therefore, we supplement. I wanted to mention just a little bit about the recommended daily allowance for vitamin D, which is pretty low at 600. This amount, 600 IUs, is the amount that is just enough to prevent the disease rickets, which is weak bones or soft bones. Rickets was identified back in the early 1800s with lack of sunlight exposure in children. So this kind of led to the discovery of vitamin D in cod liver oil that was beneficial to these children. Eventually, scientists decided that they needed to fortify milk and other foods with vitamin D, and they did this. So by the 1930s, rickets really disappeared in North America and Europe. It goes back to optimal versus normal levels. Do you want just enough vitamin D to prevent rickets, or do you want optimal levels to help your body function optimally? Okay, it's extremely important to talk about vitamin K2 along with vitamin D. These two vitamins work well together and potentiate the effects of each other. K2, the way it works is it guides calcium into your bones and away from your blood vessels. So you want calcium in your bones, but you do not want it in your blood vessels or soft tissues. So therefore, the K2-D3 combination is really good for your heart. It enhances cardiovascular health. You can purchase vitamin K2 separately, as demonstrated in this picture, but it seems easier just to get a combined product. And you can get vitamin D3 K2 in combo with the 5,000 or the 10,000 international units. Vitamin D and bone health. Vitamin D is an essential nutrient for strong bones. It's also important for muscle performance and balance as it increases protein synthesis. So, bone health and good vitamin D levels are really important for women in prevention of osteoporosis. Men can get osteoporosis too, but it is more common in women. Most people think about bone health, they think about supplementing with calcium. Well, we think it's really more important to supplement with vitamin D for your bones and your bone health. As mentioned before, you don't want to get too much calcium in the wrong places, like blood vessels or soft tissues. So vitamin D is a really strong, scientifically proven benefit for bone health. This picture here just demonstrates how with osteoporosis, you can see the bone become more porous and weaker. The key to treating osteoporosis is prevention. It's hard to reverse it. It's just much better to keep your vitamin D levels up while you're still young and prevent osteoporosis. Peak bone mass is achieved in our 20s and 30s, and then it starts going down. Vitamin D supplementation can decrease your risk for falls. It improves balance and muscle performance. Muscle tissue actually has receptors that accept vitamin D, which really is a key role in muscle function. I read that in Japan, the primary treatment for osteoporosis is 360 milligrams of vitamin K2, not the biphosphonates like Fosamax that we often prescribe in the US. And Fosamax really is only helpful in preventing fractures related to existing osteoporosis. It doesn't do a lot for reversing osteoporosis. Okay, vitamin D is really good for your heart. Heart disease is a big problem in the US. There are many factors, of course, but vitamin D deficiency is definitely a contributing factor. There was one big data review that indicated that people with a vitamin D level less than 21 had an increased risk of hypertension, diabetes, obesity, high triglyceride levels. All these are metabolic manifestations associated with increased cardiovascular mortality. We know that low levels of vitamin D are associated with increased inflammation, inflammatory markers, and these are also indicators of cardiovascular risk. There is also evidence to suggest that there's an inverse association with vitamin D and blood pressure, meaning that the higher the vitamin D level, the lower the blood pressure. There was one study that was pretty powerful for me that came out in the international cardiology literature, and it was regarding men, and it said men with low testosterone and low vitamin D, that combination, had a 5-fold increased risk for an event, like a heart attack or a stroke. So I came back from that conference and told my husband that he needed to take more vitamin D and also some testosterone. Prevention is the key. So the studies about vitamin D and cardiovascular events show that patients with low vitamin D have a higher risk for an event. I will say the studies really did not prove that treating someone with vitamin D, once they already have been compromised with heart health, that it helps a lot. It doesn't hurt, but it's not enough because kind of like the damage is already done. Therefore, it's just so much better to maintain optimal levels of vitamin D prior to being a problem. I will say also that in reading all of the different studies about vitamin D, there were different results, recommendations that came from the studies. And in some studies, they said that vitamin D didn't make a difference. Well, in those studies that resulted no difference, they were only supplementing with low levels of vitamin D, like 600 to 2,000 international units of vitamin D. Now, remember, we are recommending 5 to 10,000 a day. And so there's an easy way to see if you're getting enough vitamin D, and that is to check a blood level. So diabetes can also be linked to low vitamin D levels. Diabetes is really hard on the heart and blood vessels. So improving glucose control can keep your heart healthier. For type 1 diabetes, which is an autoimmune condition, the link with vitamin D is largely thought to be because of the effects of vitamin D on the immune system. For type 2 diabetes, the mechanism of vitamin D is that it improves both beta cell activity and insulin sensitivity. So as you know, type 1 diabetes and type 2 diabetes are very different in their disease process, but vitamin D is good for both of them. Don't forget about K2 with cardiovascular health, because K2 is essential in putting calcium where it needs to be. So vitamin D or vitamin K2, it inhibits the buildup of excess calcium in the bloodstream, and this prevents hardening or calcification of the arteries. All right, brain health. So the National Institute of Health really did this literature review about the role of vitamin D in relation to brain health. And it was pretty great. So they made these two statements here. They said vitamin D aids in the function of neuronal and glial tissue, which impacts brain function. Vitamin D deficiency has been implicated in cognitive impairment and dementia. So there's vitamin D receptors widespread in brain tissue. And so we can do so much good for the brain with good vitamin D. Vitamin D affects cognitive function, decision-making, and social behavior. It also helps regulate over 200 genes. Now, the concept of gene expression and gene regulation is a pretty complicated concept. And I came across this really interesting study where they took identical twins and supplemented one of the twins with vitamin D for 90 days to kind of see how the effect would be on the genes. So now remember, identical twins have also identical genes. So what they found in this 90-day study was they were really looking at body composition and weight. And so after 90 days, the twin that supplemented with vitamin D had lower percentage of body fat, was what the biggest thing they found. Equating for all the other factors with genes and lifestyle, it did make an impact. I guess the lesson is vitamin D can help regulate your genes in a really good way. When talking about brain health, I also have to give a shout out to omega-3 fatty acids, because vitamin D3 and omega-3s really work together for optimal brain health. And when you look at the good quality brain health supplements, they should contain both vitamin D and omega-3s. Mental health. Mental health disorders have increased with COVID-19. And low levels of vitamin D are often found in patients with a clinical diagnosis of depression or anxiety. So for patients struggling with those conditions, we really prefer a vitamin D level of 80 to 100. You know, some people might say we're actually in the midst of a mental health crisis. There's definitely a huge need for mental health providers. There was one study that looked at people with depression, obesity, and it randomized them into a year of supplementation with vitamin D. The way they did this study is they gave them 20 to 40,000 units of vitamin D every week. Participants in this study completed the Beck Depression Inventory Score, and the results were pretty amazing. It showed, as you can maybe expect, that the vitamin D group had significant improvement in their scores, whereas the placebo group did not. So the way vitamin D helps with mental health is it helps regulate the conversion of tryptophan to serotonin. So serotonin is kind of a feel-good neurotransmitter. It affects mood and decision-making. There's a lot of brain-based disorders that are associated with low serotonin, such as, well, we know depression or anxiety, but also autism, ADHD, schizophrenia, bipolar disease. Those are all associated with low serotonin. Vitamin D helps the immune system to function optimally. All of the different types of immune cells express the vitamin D receptor, known as the VDR. With COVID, there were lots of studies about vitamin D, and it was shown to be beneficial in prevention of COVID. It wasn't shown to be as good for treating COVID if patients were already vitamin D deficient, but as with most things, prevention is key. There's definitely an association between vitamin D deficiency, type 1 diabetes, multiple sclerosis, inflammatory bowel disease, all autoimmune conditions. Vitamin D deficiency increases the risk of autoimmune disease. The lower your vitamin D level, the higher your risk is for all the autoimmune diseases. Alternatively, optimal levels of vitamin D can assist in the modulation of the immune system. Observational studies have shown a definite association with a low vitamin D and type 1 diabetes, multiple sclerosis, inflammatory bowel disease, all different diseases that are autoimmune related. There was another study that showed, it was an American study, that people with levels below 20, vitamin D levels below 20, have a twofold increased risk of later developing multiple sclerosis. Optimal vitamin D levels can also reduce your risk for cancer. The World Health Organization working group identified an association between vitamin D deficiency and the risk for colon cancer. Vitamin D makes, and the way it works is it makes cancer cells less abnormal, less likely to multiply, and more likely to die. This big study of those with and without colon cancer found, like, for every 20 points increase in vitamin D level, the odds of colon cancer were reduced by 40%. There's also been association of breast cancer and vitamin D deficiency. Like I said, vitamin D is a favorite supplement for so many reasons: for our bones, for our heart, for our brain, for our mood, and for our immune system. I wanted to give just one little shout out slide to omega-3s because it's probably my second favorite supplement and one that I recommend often. And omega-3s are so good for reducing inflammation, good for your heart, good for your cholesterol, lipid profile, good for your brain, mental health. We recommend a minimum of 1,000 milligrams of omega-3s a day. Actually, good data to suggest that the high dose omega-3s can be beneficial as well, up to 5,000, if you can tolerate that. So I just wanted to list just the other few of my favorite supplements. I do get asked that a fair amount. Of course, vitamin D3, K2 are top of the list. Omega-3s are up there. I love a good multivitamin. Probiotics, good gut health. DIM, D-I-M, stands for diindolylmethane. It's found in broccoli, cruciferous vegetables, and it's really great for our hormone patients that we see in the office. Also like magnesium and melatonin. So it's never too early or too late to work towards being the healthiest you. So if you've never done supplementation or vitamin D or anything, it's not too late. You can start. Here's some information if you'd like to get a hold of our office. feel free to give a call and ask questions, and we would be happy to provide you with all the information you need. Thanks and take care.